So today we are studying about the norma verticalis. Now, before studying about this particular term, we need to understand that where is it coming from and what other and why are we actually studying this. So for that, we need to understand that to study the skull, we are actually here trying to study the skull from the outside. So to study it from outside, we study it under different views. So we have different views under which we study the skull. We have norma verticalis, which is the superior view. Then we have norma occipitalis, norma basalis, norma lateralis, and then we have norma frontalis. So we are studying the outside of the skull. We have to study the complete skull, right? So we are studying it with different views. The norma verticalis being the superior view for us, occipitalis being the posterior view, basalis being the view inferiorly, and norma lateralis is the lateral view, and frontalis is of course the view from the front. Now coming to norma verticalis, which is our today's topic, we here need to see that what is the shape when we are looking at the skull from this view. So while looking at the skull from this view, the shape is mostly oval, and you will see that the anterior part, the anterior portion and the posterior portion. So the skull in this view, from the superior view, it is wider posteriorly than it is anteriorly. It is quite visible over here, right? We're done with the shape. Then we look about the bones that we can observe and appreciate from this view. So we have the frontal bone, then we have the occipital bone and the parietal bone. Of course, here you can see this is the frontal bone we have. It is present anteriorly. The occipital bone is present posteriorly. And the lateral bone is present laterally on both sides, right? So the frontal bone you can see here, then we have the parietal bones on each side, and then we have the occipital bone. Now after this, we look at the sutures that are visible through this view. Firstly, we have our coronal suture, then we have what is called as our sagittal suture, and then we have lambdoid suture. Now you need to understand that the coronal suture over here you can see this suture here is the one which is connecting, which is present between the frontal and the parietal bones. So the suture which is present here between the frontal and the two parietal bones on each side, this is known as the coronal suture. See, so that you don't forget, you can remember it this way, that here coronal suture here in front is the most anterior suture. It is between the frontal and the two parietal bones. Then we have the sagittal suture. It is present between the two parietal bones. And then we have the last one, which is the lambdoid suture. It is present between the occipital and the two parietal bones. So coronal suture, sagittal suture and the lambdoid suture. Done with these. Also we need to see here that this coronal suture here is crossing from side to side the cranial vault. So this is the cranial vault, the upper part of the skull, right? And the coronal suture is the one which crosses it from side to side. Then we also see that here what are the different features. Before that, we have another suture which is known as the metopic suture. This suture is present only in 3 to 8% of the individuals, and it is occasionally present, and it is the one which fuses at around the 6 years of age of the individual. So this metopic suture is present here like this. It is present separating the two frontal bones, but it fuses around the age of 6 years, and it is occasionally present in 3 to 8% individual if it doesn't fuse. Then we have the different features. So firstly, for the features, we have the vertex. Now for that, you need to see here that if we consider this to be our sagittal suture, so we are looking at the skull from the lateral side. Consider this the lateral view. So what will you see? You will see the dome of the skull, right? You will see the dome of the skull. Here, this is your sagittal suture, right? The highest point of your sagittal suture is known as the vertex. So this is the highest point of your sagittal suture. This is the vertex. Then here, if you see, we have this dome of the skull. In this dome, the arched roof, so this is the arched roof in this dome. Arching is just forming an angle and elevating upward. So we are forming an arch here, right? So this arch of the dome of the skull is known as vault. So another feature is the vault, which is the arched roof of the dome of the skull. Then we have the bregma and the lambda. The bregma here is this. The bregma is the meeting point of two sutures. Here you can see the coronal suture and the sagittal suture. The point at which they meet is known as the bregma. Then we have another point, which is the lambda. The lambda is the meeting point between the sagittal suture, this is your sagittal suture, and your lambdoid suture. So repeating again, bregma is the meeting point of coronal suture and sagittal suture, and your lambda is the meeting point between the sagittal suture and the lambdoid suture. We have bregma, we have lambda. You also need to see that bregma here is the site of the anterior fontanelle which is present in the fetal skull. Anterior fontanelles are nothing but these are gaps which then get filled, which then disappear as the individual grows. So the anterior fontanelle, this is the site of the anterior fontanelle in the fetal skull, which closes at the age of 18 to 24 months. Okay. And same for lambda. This is the site of posterior fontanelle in the fetal skull. Okay. Then another feature that we have is the parietal eminence. So the parietal eminence is the area of maximum convexity of the skull. So this is the site for. So if, for example, this is, you're looking at it like this, and if you see, this is your parietal bone. So in your parietal bone, wherever there will be maximum convexity like this, like where it will be most convex, so that point will be known as what? Your parietal eminence. Then another feature that we have is oblion. Now this oblion is the point which is present between two parietal foramen. So these parietal foramen, these are for emissary veins, and these are present in the parietal bone. So the point which is present in between these on the sagittal suture, not anywhere, but this point is on the sagittal suture in between the parietal foramen, is known as oblion. Then we have the most important ones, which are the temporal lines. Now the temporal lines, as you can see here, this here, right here, and this is the temporal lines. Why are these present? Now if you see, we have two temporal lines, right? We have the superior temporal line and we have the inferior temporal line. Now in these lines, for that I'll show you a diagram here. So if you can see over here, here we have these lines. So this one here, right here, is the superior temporal line, and this one is the inferior temporal line. And these lines, these are here forming the upper border of the temporal fossa. Here we have the temporal fossa. So this is your temporal fossa, and the upper boundary of this temporal fossa is formed by these two lines, right? Now, one important thing about them is that we have two of them. So the superior temporal line, both of these, they start at the zygomatic process of the frontal bone. Here, this is the zygomatic process of the frontal bone, and then they cross around the frontal bone, then through the coronal suture. This is your coronal suture, right? So this is your coronal suture. So these are crossing around from the frontal bone to the coronal suture, passing along to the parietal bone. Now the superior line here, it fades out over the posterior part of the parietal bone. Here it fades out. But your inferior temporal line, it doesn't fade out. It continues to the parietal bone and it continues downwards to the formation of the here continues downward to the formation of the zygomatic arch. Here this is a zygomatic arch. So this was about it. This is your temporal fossa, and these lines, these give attachment to different muscles of chewing. And yeah, here we are done with the norma verticalis. Thank you.